Asthma Awareness Month, and that takes on added significance in the midst of this pandemic. COVID-19 is scary for everyone, but for those with asthma, there's a great fear they'll have a worse outcome if they get infected. Allergist and immunologist Dr. Reena Mehta joins us via FaceTime this morning with some information on that. Good morning, Dr. Mehta.
Good morning, Meg.
So early on, we had heard that people with asthma were more susceptible to getting COVID-19. They could have, more repercussions from it. Is that true?
So the risk of infection and the risk of a more severe illness in somebody with asthma has been highly debated during this pandemic. And so what's interesting is that what we found is that patients with asthma are not actually having any more severe illness than the general population. And in fact, are not at any increased risk of having the infection. There was one study recently, a small study, but it did show that asthma was actually reported less than expected in those with COVID-19.
Wow,
And
that's
the
great
New York
news.
Times, the New York Times actually recently reported their top 10 comorbidities, and asthma was not listed there as one of your risk factors for death from COVID-19.
Interesting. So I guess it's imperative, though, that people with asthma control it, keep it under control, as more COVID cases continue to pop up.
Absolutely. And so that's the one thing that doctors can agree on. It's really important to keep your asthma under control during this pandemic. And that may be why we're seeing less asthma in our COVID-19 patients, because people are keeping it under control. And so it's really important for you to stay on your maintenance medications for asthma, because if you develop an asthma exacerbation, that often means ending up in the emergency room or the urgent care, where your risk of actually getting COVID-19 from exposure from 6 patients is much higher than actually getting sick from your asthma.
What does the role of steroids play? I know you were telling me a lot of people who have asthma take steroids right now.
And that's a great question. Initially, when this pandemic started, there was some literature that suggested that steroids were contraindicated, should not be used in people with COVID-19 because it increased their risk of a severe illness. And what we found is that did not look at patients with asthma. And so it's really important that asthma patients stay on their controller medications, because that's what's going to keep their lungs healthy and keep them from actually getting exposure to COVID-19. So please, if you have asthma, stay on your controller medications and keep your asthma under control so that you don't get more sick.
Now, this is something I thought was interesting. I know a lot of people with asthma, not a lot, but a good number use nebulizers at home. I remember I had to use one as a kid. But there's something special you should do now if you are concerned about COVID-19 and you use a nebulizer.
Exactly. So if you have an asthma flare or you're having some respiratory issues and need a breathing treatment, think about using your inhaler before using your nebulizer. The reason for that is when you use a nebulizer, you put your mask on and it aerosolizes respiratory droplets. And so if you have COVID-19, you're actually spreading your respiratory particles into the air, and that can stay in the air for 1 or 2 hours. And so using an inhaler actually prevents this. And if you absolutely need to use your nebulizer, do it in a place where you're alone, so you don't risk anybody else getting sick, or you're outside.
And last but not least, a pulse ox. Should people have that at home?
Okay, so what a pulse ox is, it's a clip that goes onto your finger, and you can measure your blood oxygen level. And so typically a pulse ox is not one of the tools that we use for controlling asthma at home. Usually for controlling asthma at home, it's a reflection of your symptoms, sometimes a peak flow meter, and following an asthma action plan provided by your doctor. Now, however, if you get COVID-19 and you have a lot of risk factors, your doctor may recommend getting one of these pulse ox to use at home to measure your blood oxygen level. And so it just depends on the situation. If it's just for asthma, typically we don't use it. But if you have COVID-19 and you're very sick and your doctor recommends it, it's a good way to check your blood oxygen level. Just knowing, though, that sometimes these can provide some inaccurate readings. And so just making sure that you truly understand how to use the device and going over it with your doctor if you really feel like you need it.
All right, Dr. Reena Mehta, thank you for your time this morning.
Thank you so much for having me.